Mga katropa, alam mo ba na ang DWDD, Navy at Air Force na siyang maghahatid sa inyo ng mga balita mula sa ating Armed Forces at iba pang impormasyon. Mga katropa, hanapin at ilike kami sa Facebook, Twitter at YouTube. DWDD AFP Radio, ang boses ng Kawal Pilipino.
Nagpares bakuna ako para may dagdag protection mula sa COVID-19. Lalo na ngayon, dapat umiwas sa malubhang kaso nito.
At dahil kailangan kumayod para sa pamilya, dapat bawas pangamba saan man pumunta.
Kasama ng mask, hugas at iwas, mas protektado tayo pag may res bakuna.
Napatunayang ligtas at mabisa ang res bakuna. Kaya buong pamilya ko, naka 2 doses na. Libre lang ito. Pumunta sa inyong health center o tumawag sa DOH 1555 hotline.
There are those who choose a different path in life, a path of honor, patriotism, duty, a path for professionals to reach their best potential, a path of service and compassion, a path that leads to freedom. It is the principle of putting service above self that is at the heart of every soldier.
Ito ang DWDD 1134 kHz AM. Balita, impormasyon at musika. Ito ang DWDD AFP Radio, boses ng Kawal Pilipino.
Mula noon hanggang ngayon, ang iyong AFP Health Service Command patuloy ang pag-aalaga, pagbabalita ng mga serbisyong pangkalusugan para sa mga kasundaluhan at sibilyan.
Ito ang iyong usapang health service dito lang sa DWDD AFP Radio. Iba tayo!
All right, good afternoon ladies and gentlemen. Once again, hello Philippines and hello world. Ito ulit ang mga kaganapan at impormasyon na maghahatid balita at katuwang mo sa oras na ito. Magandang hapon, Luzon, Visayas, and Mindanao. And so we are so excited right now, no? Because we do have a lot of guests na syempre makakapanayam natin later on. But anyway, sabi ko nga, ito nga po ulit si Katropang Major Rhey B. Mallorca, Nurse Corps, inyong Assistant Chief for Public Information Office ng inyong AFP Health Service Command. Tutok lang dito sa DWDD AFP Radio, ang boses ng inyong Kawal Pilipino. Ayon. So of course, we would like to greet the personalities behind this USAPANG Health Service. We would like to recognize the importance, lalo na ngayon, di ba? It's a Monday afternoon, 13 June 2022, to our commanding General Cardinosa, our commanding ng ating AFP Health Service Command. The same time, General Edgar M. Cardinosa, sir. Good afternoon to our Deputy Commander, AFP Health Service Command, Colonel Marinela Kailipan, Medical Corps. And also to our Chief of Staff ng ating AFP Health Service Command. Huwag natin siyempre makalimutan, lalo na kasi malapit ng malilipat si Sir, no? But anyway, thank you for the support, sir, in behalf of your AFP Health Service Command family. At the same time, your Public Information Office, laging sumusuporta sa atin dito sa Usapang Health Service. Colonel Lauro Oliveros, Philippine Army. Good afternoon, sir. And of course, no, it's a nice way of introducing ourselves here in Southern Luzon Command Headquarters, no? Live po tayo dito sa Camp Guillermo Nacar, Lucena City. Alright. Barangay Gulang-Gulang. Tama po ba, ma'am? Barangay Gulang-Gulang, Lucena City. And of course, we did a good job here because we did a proper coordination with syempre, ating counterpart from the Public Information Office, headed by Colonel Cana, Philippine Army, Of course, siya yung Chief PIO, same time the U5 of Southern Luzon Command. And of course, babatiin rin natin kung sino yung pinaka-head dito sa Southern Luzon Command, di ba? Kasi part of our Health Service Southern Luzon, later on that I will be recognize them, each of them, no, dito. Of course, papakilala rin natin, batiin rin natin, no, ang ating commander ng Southern Luzon Command and his staff, no? Kasi binigyan tayo ng pabor dito upang magkaroon ng magandang setup dito sa kanilang officers clubhouse. No other than Lieutenant General Bacaro, Philippine Army. Maraming salamat, sir, sa opportunity na binigay niyo sa amin dito sa Usapang Health Service. And of course, to the AFP Health Service Command, Southern Luzon personnel, headed by the Chief Health Service Center, Acting Chief ng Health Service Center, Southern Luzon, Colonel Mandal, later on, ma'am, to formally recognize. And of course, sa ating mga assistant, no, dito sa ating Usapang Health Service, no other than the Civil Relation Group ng ating CRG personnel ng AFP. Of course, nandito rin sila to support us. At of course, mga staff ng ating technical staff from the Unified Command ng Southern Luzon Command, from the H6 or U6, our counterpart, same time our CRG personnel. Maraming salamat po. And of course, we would like to introduce to you later on ang ating mga guests for this afternoon. But anyway, don't forget to subscribe and follow our official FB page ng inyong AFP Health Service Command Public Information Office na laging nakatutok at syempre mabibigyan ng good information dissemination campaign dito sa Usapang Health Service. Wala po tayong bias, lahat po ay in-introduce natin kung anong nangyayari sa ating health service in the AFP, because we are aiming later on by 2028, ma'am, that we could be a world-class health service provider by the AFP. Ayun. So, magandang yan ha. Siyempre, lalo na ngayong umaga that we will be having a good interview portion with our Health Service Southern Luzon, no? Because for the information of everyone, ito yung hindi naman one, parang second time, no, nagkaroon ng Best Center. So right now, this year, by 2021, sila ang tinanghal na Best Health Service Center, Southern Luzon. Congratulations, ma'am. All right. Palakpakan naman natin. And of course, i-introduce ko na, of course, ang ating Acting Chief for Health Service Southern Luzon, no other than he's a Nurse Corps officer at the same time, concurrent, the Chief Nurse of the hospital ng Camp Nakar Station Hospital, no other than Colonel Arlene M. Mandal, Nurse Corps, General Staff Corps. Hi, ma'am. And of course, our Commanding Officer ng Camp Nakar Station Hospital. Ayun. Napaka-close person to me kasi nagbubulahan lang kami sa Biluna. But anyway, right now, it's a nice way of meeting this guy, no? Sir, no? Si Sir Zabala, no? Of course, no other than Colonel Nerio C. Zabala, Medical Corps. Sir, magandang hapon. Of course, he's a fellow Philippine College of Cardiologists. No? Kung may mga sakit tayo sa puso, wag lang yung mga pagmamahal na kinakailangan natin. But we're talking about heart ailment or illnesses. No? Libreng-libre pupuntahan natin ang ating Commanding Officer, Colonel Nerio Zabala, sir. And of course, together with us, our CEO, our Commanding Officer ng Camp Nakar Dental Dispensary, no other than Colonel Joel A. Arcilia, Dental Service General Staff Corps, sir. Good afternoon, sir. Thank you for coming over. And of course, ang ating acting pinakabata, Commanding Officer ng Veterinary Dispensary, no other than First Lieutenant Revere M. Guevara, Vet Corps. Ayan. So, ma'am, any bati naman sa ating mga katropang nakikinig at nakikibalita sa atin dito sa Usapang Health Service?
Magandang hapon sa mga katropa dyan ng Usapang Health Service. Magandang hapon sa ating lahat. Nais ko ding batiin ang pangkat na mga magigiting ng Southern Luzon Armed Forces of the Philippines.
Marami-rami sila, ma'am.
Yes, nais kong pinangungunahan ng aming commander, no less than Lieutenant General Bartolome Vicente O. Bacaro, Philippine Army, the Commander of Southern Luzon Command. Gusto ko ring batiin, syempre, ang pangkat ng mga tagapangalaga dyan sa AFP Health Service Command na pinangungunahan ng ating Commander, Brigadier General
Edgar.
M. Cardinosa, Philippine Air Force.
Ayun.
At gusto ko rin syempre batiin ang pangkat ng mga magigiting na tagapangalaga ng Health Service Center Southern Luzon na pinangungunahan ko at ng aking mga sigang commanding officers ng hospital.
Mga gwapong.
Dental, yes.
Mga gwapong commanding officer, ma'am. No?
Dental
Ang babata
and
nila, ma'am.
Ganun ba?
Oo.
At sa buong kasandaluhan ng Armed Forces of the Philippines, magandang hapon sa ating lahat.
All right. Thank you, ma'am, for giving us this opportunity to be on live here at Southern Luzon Command, lalo na dito sa Lucena City.
Thank you. It's our privilege.
Yan.
Thank you so much.
Sir, bati naman, any shoutout dyan sa ating mga viewers bago tayo magbalitaktakan ng mga information na kailangan malaman nating Southern Luzon area?
Ay, ang pagbati ko ay base sa aking SOI.
Sir, mahaba-haba yun.
Hindi, masabi lang naman. So, binabati ko yung aking mga kasamahan sa Camp Shonko Station Hospital. Sino man naalala ko doon? Sina Ate Dina.
Parang layo na. 6ID ba yun?
Hindi.
Camp Shonko.
Camp Shonko Station Hospital is based on 6ID sa
Ayan.
Maguindanao, kung saan the most fightingest division in the Army.
Yeah.
Tapos, syempre,
Matagal si Sir doon. Ilang years ka doon, Sir?
2 years.
2 years.
2 years ako nagbibilang ng mga bituin. Alright. So, syempre, binabati ko rin aking mga kasama sa Department of Internal Medicine sa Viluna Medical Center. Aim for excellence always. At aking kasamahan sa Fort Derpillary Station Hospital.
Sa PMA.
Sa PMA, kung
Ayun.
saan ako ay nakatikin na maging commanding officer. Okay? So,
Okay naman yung experience mo, sir, sa PMA?
ang experience ko sa PMA, ang aking leadership survey is 3.65 excellent.
Okay. PR ba yan?
PR yan.
Alright.
Ang aking PR sa PMA is perfect. Okay? So, maganda experience ko sa PMA. Tapos, sa aking mga kasama sa GSC, Seminar Hope, ang aking seminar leader, Lieutenant Colonel Marlon Mojica, ang aking kababayan, si Lieutenant Colonel Renovales, ang kabady ko sa Commandant's Paper, si Colonel Alexander Ogoy. Ang NC ito, nakasama ko si Colonel Villarias. Yun lang naalala ko sa tele.
Sir, parang marami-rami yan.
Marami-rami ito. Okay.
So, ka-guestbook ba yan?
Tama na itong shoutout na ito. Baka maubos yung magalit.
Alright. So, congratulations, sir. Thank you for introducing. Sir, dental naman, sir. Sir Arcilia, sir. Any bati sa ating mga kasamang nanonood sa ating shout out.
Isang magandang hapon sa ating lahat, sa mga katropa natin sa buong Kapuluan. Binabati ko ang personnel ng AFP Dental Service na naka-deploy sa lahat ng bahagi ng ating Kapuluan. Kayo po ay matyagang nagtatrabaho ngayong pandemic. Kahit na wala tayong social distancing, nagagawa pa rin natin ating trabaho. Sa ating mga kasama rito sa Health Service Center, Southern Luzon, at sa pangkat ng magigiting, Solcom, magandang hapon sa ating lahat.
Alright, thank you, sir. What about our pinaka-youngest sa members ditong araw na ito? No other than Colonel, Lieutenant Guevara. Any shoutout naman? Na-promote bigla. Kasi nakikita ko puro Colonel. Sige, bati naman sa ating mga viewers.
Magandang hapon sa ating lahat. Gusto ko lang batiin yung previous unit ko sa Veterinary Service Center sa General Emilio Aguinaldo. Magandang hapon sa inyong lahat.
Alright, so anyway, thank you for giving us the mga shoutout natin sa ating mga friends, mga loved ones, or sino man yung mga dating nating assign tayo doon sa mga areas of, sabi nga ni Sir, from 6ID to PMA and other areas. Kasi Sir, dito sa Usapang Health Service, we are not just live within the Philippines, but we are internationally via YouTube channel. So don't forget to subscribe our AFP Radio, Usapang Health Service. Lagi po dyan, nakatutok. Kung meron tayong mga camera or cell phones, madali na lang because a lot of our personnel right now, or even the Philippines, social media talaga enthusiast na ngayon. So 80%, imposibleng walang cellphone. So at least maganda na they're from Dubai, from USA. Marami po nagko-comment, nag-shoutout sa atin na we still need to continue promoting the health service of the Armed Forces of the Philippines para malaman nila kung anong mga kaganapan dito sa ating modernization, treatment, and management of care, especially sa mga personnel, trainings, and all the rest dyan po sa ating AFP Health Service Command. Mapa-Viluna man yan or mapa entire Philippine archipelago. Kasi we are from Visayas, Luzon, and Mindanao. No? Meron po tayong mga centers na available po doon if you need help. All right? So moving on, while we are having our conversation, we need to have a glimpse muna, no, of what is really the Health Service Southern Luzon. So we'll try to look at a simple glimpse of our audio-visual presentation. Pasok naman, mga kasama.
The Health Service Center Southern Luzon is one of the units in Camp Guillermo Nakar. This is an offshoot of the activation of Health Service Command on 01 April 2017 by virtue of General Orders No. 371, General Headquarters AFP, dated 21 March 2017. The Health Service Center Southern Luzon provides health service support to all organic and component units of Southern Luzon Command AFP that operates in Region 4A, Calabarzon, Region 4B, Mimaropa except Palawan, and Region 5, Bicol as its area of responsibility. Through its three operating units, Camp Nakar Station Hospital, Camp Nakar Dental Dispensary, and Camp Nakar Veterinary Dispensary. Headquarters Health Service Center Southern Luzon capabilities. Formulates and promulgates policies on all administrative matters including military records, publications, claims, and leaves. Plans, formulates, coordinates, and supervises activities pertaining to ceremonial, recreational, and other command-related activities. Plans and implement procurement activities and provide logistic support to the subordinate units. Responsible in the planning, programming, and budgeting system of the resources in its subordinate units. Provides management and administration of healthcare services, inpatient and outpatient care, ancillary services as well as preventive services, dental care services, and veterinary services. Camp Nakar Station Hospital was constructed on 18 March 1991 by virtue of AFP TOE number G08-9 dated 5 April 1991 as a primary station hospital under the leadership of Brigadier General Federico E. Ruiz Jr., which aims to provide quality health care services among military personnel, their dependents, and authorized civilians under SOLCOM's AOR in support.
All right, so at least we do have a glimpse of what is really happening right now at Health Service Southern Luzon, knowing about the area of responsibility na napakalawak, no? Considering this is, ano ba mga regions to, ma'am? Region 4, 5. Later on, siyempre, sasagutin ni ma'am yun kasi that will be one of my questions. So, we could now go and move on. Kasi si Sir excited talaga dito si Sir Sabala. No? Hindi ko alam kung anong gusto niyang sasabihin. But anyway, talking about the good-looking and siyempre pretty woman na nandito sa atin, kasama natin. Pretty woman, walking down the street. Kanta pala yun, ma'am. So anyway, yun nga, kailangan natin malaman pagkaling sa kanilang mga bibig. No? That those are important and relevant information na malalaman natin mga katropang nakikinig, lalo na sa Southern Luzon Command. Ma'am, first question, no? Ano po ba ang role at misyon ng inyong AP Health Service Southern Luzon? At saan po ba ito matatagpuan at anong sakop na lugar at area of responsibility nito?
Okay, magandang hapon sa ating lahat. Health Service Center Southern Luzon is one of the 6 centers of AFP Health Service Command. And basically, this provides health services to the area of responsibility of SOLCOM AFP, which covers the area of Region 4A, Calabarzon, Region 4B, Mimaropa, except Palawan, and Region 5, Bicol.
So yan yung mga areas, no? Ang lawak pala, ma'am, no? Considering the vast talaga na areas nitong Southern Luzon Command. Because actually, this is not my first time, but this is my second time to be here at the Lucena City kasi nagkaroon kami ng medical mission. Siguro parang dumaan lang kayo, ma'am. But at least we have identified that area of responsibility. Ang lawak pala dito sa areas ng Southern Luzon. Ma'am, ilan at anong unit ang nagsusuporta sa Southern Luzon? Ayun, malaman ng mga tropa.
Inside the Camp Guillermo Nakar, sa loob ng Camp Nakar, no,
Alright.
we have tenant units and post units, which includes 2 IMB, Tausol or TOG 4, then 2 CAV, 2 CRG, Fort Fasu, including us, Health Service Center Southern Luzon, 3 CEISG, among others. But outside the Camp Nakar, we have the 2 joint task forces, Task Force Katagalugan and Task Force Bicolandia.
So malawak, ma'am, no? Considering 9th ID is one of the, ma'am, no? Under ng Southern Luzon Command. At the same time, from the Navy, of course, we need to recognize yung mga health services dyan, no? Sa Southern Luzon, area of responsibility, lalo na sa Naval Forces Southern Luzon. Ayun, to recognize.
Composite kasi siya.
Of course, composite,
Yung mga
yes, ma'am.
task forces na yan ng land,
Air, lahat
air,
po, ma'am, no?
and
So,
component.
all right. So, yun, at least nalaman natin mga katropa na we could avail dito sa, syempre, dito sa ating mga, sa Health Service Southern Luzon, no? These are personals na, of course, na kailangan natin bigyan pansin because, syempre, sila yung mga, the services that we render, no? They are stakeholders dito, ma'am. So, at least nalaman nila. So, anyway, ma'am, ano-ano po ba ang mga capabilities meron na ipagmamalaki mo sa dito sa interview na ito sa ating Health Service Center Southern Luzon?
Yes, being the acting chief of Health Service Center Southern Luzon, we provide the administrative and management support to the 3 operating units, the Camp Nakar Station Hospital, headed by Colonel Zabala, the Dental Dispensary, Camp Nakar Dental Dispensary, headed by Colonel Arcilia, and the Camp Nakar Veterinary Dispensary, now the acting CEO, Lieutenant Guevara. We also provide at the level of the center, so we provide the administrative requirements of those units in terms of personnel, logistics, finance, among others, since the center is the one who communicates directly to the leadership of AFP Health Service Command. Together with the 3 commanding officers, we plan, execute, and evaluate all the programs, project, and activities within the mandate and mission of the Health Service Center Southern Luzon. In fact, it is clearly stated or embodied in our balance scoreboard. Okay,
So-
we provide inpatient services, outpatient services, dental services, veterinary services, preventive services. We also do the deployment. Now we have the forward service support.
All right. So ang dami, ma'am, no? Ang dami palang capabilities na meron na inyong Health Service Southern Luzon na hindi pa alam ng ating mga viewers, lalo na kung dito kayo sa area ng Southern Luzon Command, no? Lalo na sa mga Philippine Army, Philippine Air Force, or Philippine Navy. Visit here, no? Dito sa ating Camp Guillermo Nakar Health Service Southern Luzon. Makikita nyo ang mga kagwapuan at kagandahang mga babae in charge to treat, to manage all the capabilities when talking about the medical service, the dental service, and the veterinary service na inyong pangangailangan. Ayun, di ba, ma'am? Ang ganda talaga pakinggan. No? I think the teamwork really played a major role dito. Kasi nung una pa lang pagdating ko dito, ma'am, nakikita ko na all of the personals are working hard for the development, lalo na nakuha itong Best Health Service Center Unit of the Year. Ayun. So makikita nyo sa likod ko, ito yung mga plaque of appreciation na meron ang inyong Health Service Southern Luzon. Kaya, syempre, this will be a big challenge sa atin, sa mga kasama natin sa different areas ng health services, no? Diyan sa Palawan, sa Zamboanga, could be Cebu, could be Davao. So imagine, they have 200,000 ba, ma'am, ang na-receive during the anniversary, during the Best Health Service Center. Kaya, there are a lot of, syempre, qualifications or requirements to be adjudged as the Best Health Service Center. Alright, anyway, moving on tayo, ma'am, no? Siyempre, excited na kasi ito si Sir Sabala. Sir Nerio. Sir, we're talking about the hospital and the medical facility, no? Being the commanding officer ng Camp Nakar Station Hospital, sir. Ilan po ba ang bed capacity na meron ang inyong hospital ngayon na?
So, sandali ha. Kanina kasi na nagsasalita yung chief namin, feeling ko si Miss Katro nagrehan sa tabi ko.
Okay talaga, sir.
Parang Miss Universe sa tabi ko. The hospital has a 21-bed capacity. Tapos we offer wellness programs sa OPD. So as of now, yung mga hypertensive dito sa amin, libre ang maintenance. So we focus on that sa diabetes. So also we do surgery, minor surgery, may ortho kami dito. We also have internal medicine internists. At the same time, we have a cardiologist here from the Philippine Heart Center.
Yeah, pinagmamalaki. Nakala ko public health center.
No.
Philippine Heart Center pa yun.
Right?
Ayun.
So we also have an OB. Meron na kami mother,
OB.
baby friendly.
Yan.
We have also pediatrician. So nakatipid na yung mga ating mga kasundaluhan sa mga anak nila. So we are having a of the consult of pediatrician. No? And magtatawag mamaya yan yung sasabihin.
Mamaya mo na sasabihin, sir, no? So a lot of this, you are an infirmary ba, sir, no? Licensed to operate
Yeah,
by the
we
Department of
are
Health.
an infirmary. Sasabi ko na ba yung plano? Hindi pa.
Hindi pa, wala mo na.
Infirmary parang
Para
plano
malaman
yan.
nila bakit infirmary pa ngayon ang ating health service Southern
Yes, hindi
Luzon.
siya babying pinapalaki ha. Okay lang, okay lang.
Kasi talking about the level of accreditation, no, it started by a small dispensary.
And infirmary, tapos level 1, meron na siyang OR, level 2, departmentalized na yung
Hospital,
departments,
apo.
level 3, parang Victoriano Luna Medical Center.
The highest
So,
echelon of care.
Ang target lang namin level 1 as mandated by the vision and program ng Health Service Command. Kasi pag nag-level 2 kami, pagagalitan kami.
Alright. Of course, we need to abide by the SOPs and the procedures, ano, which is very relevant dito sa ating usapang health service. Kasi maraming nagtatanong, bakit ganun lang kaliit ang ating hospitals, no? Why not na, bakit dapat kailangan maging privatized kagad tayo? Parang ganun, sir, diba, considering?
Hindi kasi syempre, we base our decision on the data. So kung sa data natin, hindi lang kalaki ng hospital, hindi dapat. And because also SOCOM and also NOCOM is just within reach of Victoriano Luna Tertiary. So it is not cost effective to set up a level 2 hospital here. So
yung mga resources, sir, no?
Resources, sayang. Besides yung personal, yung data statistic kung ilan pong patient dito, sayang. So, not wise.
Correct. Okay. Thank you, sir. Anyway, sir, how about po sa mga kagamitan ng hospital, lalo na po sa mga medical evacuation plan, syempre sa mga ambulance transportation, in case there are emergencies that may happen in the area of responsibility ng Southern Luzon?
As of now, we have 2 medical teams, tapos ambulance. And we are happy to announce that we are able to secure donation of a new ambulance from Congresswoman Tan, now Governor-elect Tan, through our stakeholder engagement. We are so proud of our stakeholder here. So no expense to AFP, no expense to AFP Health Service Command. We have a new ambulance.
Alright. Pinagmamalaki ng AFP Health Service Command, lalo na dito sa Southern Luzon Center, no? Health Service Southern Luzon, ang kanilang stakeholder engagement na which is very relevant for us to, syempre, to compensate what is the needed requirements sa ating mga hospitals. Because considering that the AFP Health Service Command, it's a wide variety of centers, post units na maraming pagbibigyan. Lalo na kung if you're assigned in Viluna Medical Center, considering the budget allocation na ganito lang, di ba, sir? At comparing na malaking mga pasyenteng kailangan requirement, talking about the funds, lalo na kung it talk about operation of the heart, di ba? Malaki yun, sir. Cost, how much does it cost, sir?
It costs you with 600 to 800,000 at the Philippine
Kailangan mo
Heart Center.
magpapa-opera ka lang ng open heart surgery, sir, no?
And you're not allowed to ask the PF of the doctor. Thank you.
Ganon. Alright. So pag nandyan si sir, syempre, libre na, sir. Discounted pa.
Discounted pa.
So para at least alam ng ating mga viewers na nanonood, lalo na these are very relevant information, no? Kung halimbawa, basic kasi sa atin, sir, na nagkakaroon ng mga heart diseases, no? Very common, mga high blood or any mga diabetes, no? It could affect the heart, no? Or the ailment, no? So basically, syempre, si sir sa bala ng bala sa inyo. So punta lang kayo, libreng-libre, walang PF, dahil serbisyo ang tinututukan ng inyong Health Service Southern Luzon. Alright. Okay pa, sir? Sinusuportahan kita.
Okay.
Alright, sir. How about yung sa ano natin, sir? How about po sa mga skills ng ating mga doctors, mga nurses, lalo na, sir, kasi syempre hindi nila alam na, sabi nga natin, we do have ortho doctors, we do have dentists. How are they doing it to have our continuing progress or continuing development, no, para to improve our services?
Okay. We have included in AAPPB first yung pag-attend ng convention for doctors, for nurses. We also included training like ACLS, BLS in our staff. So every year, we identify training for our staff. So, all personnel, medical personnel in health service center, in our station hospital, skills are updated every year kasi what is correct right now might be incorrect next year because of another that come up. So don't worry about we are of international standard. We do not attain national standard, but we aim for international standard.
Okay. All right. Sabi ni Sir, international, not national standard. Ang galing. Because we want to be, sir, competitive enough naman. Kasi we're talking about lives here, no? Hindi naman ibig sabihin nila we're computer programming. Iba to. Ang course namin dito, we are medical allied. We do services for the welfare of our patients. Lalo na talking about the lives of every personnel ng Southern Luzon. Galing mo talaga, sir.
Matagal ko nung alam ata yan.
Sir, meron po bang mga karatig hospitals, no, na the usual na meron tayo or right now updated memorandum of agreement that we need to consider? It could be government man or it could be private hospitals na surely that we could really give importance to the needs of our patients, lalo na kung halimbawa hindi natin kaya sa ating level of care.
We have established MOA because we have cases that if we transfer to Biluna, they would not reach it. So we need with local hospitals here in Lucena City, like the Quezon Medical Center for the government and the St. Anne for the private. So no, it is an operation. Right now, we have MOA for the local hospital. So yung mga kasundalo natin, you will be well taken care of.
Ibig sabihin, sir, how long ba it will take na for you to have an evacuation kung papuntang Biluna? Kung mga average?
The average is
sasakyan, ambu transportation.
2.5 hours to 3 hours. So if emergency, we'll
Siyempre, wag na natin papuntahin, sir.
Yeah.
No? So it's a case-to-case basis. Baka magulat kayo na bakit dito kayo dinala agad sa private hospitals. Because sabi nga ni sir, it will take you a long journey, no, going through a long hour to travel, even though we are using, sir, ng medical ambulance. No? So basically, with the help of the memorandum of agreement with our partner stakeholders, partner hospitals, other government na hospitals, we could have a good services that will stabilize our patient. And right then and then, we could also, syempre, that's the time that we could evac the patient to Biluna Medical Center. All right. Sir, dito pa, merong mga katanungan dito, no? Sa nagdaang selebrasyon, ay, para pala kay ma'am to, no? Sa nagdaang selebrasyon, ma'am, no, ng AFP Health Service Command, it was our 5th founding anniversary, no, ng AFP Health Service Command. Ma'am, bakit kayo tinanghal na best center at ano po ba ang ikinalamang natin, no? Considering sa 6 na centers na meron ang inyong AFP Health Service Command, what will be your advantage then?
Okay. So thank you so much,
It's
AFP Health Service Command.
It's a Miss Universe question ba, ma'am?
For our award.
Ipagtanggol mo yan, ma'am. Bakit?
Yes, during the 5th AFP Health Service Command founding anniversary. Thank you so much for the award. Actually, sa tingin kong winning, ang nagpanalo sa amin doon is we are very research-based oriented organization. So we made yung capability of Camp Nakar Station Hospital, transitioning from an infirmary to a level 1 hospital, and a basis for the revision of TDA for Unified Command Hospitals. So from there, we developed our 6-year strategic plan. No, ina-align namin sa roadmap ni AFP Health Service Command sa scorecard ni Commander AFP HSC.
We need to align talaga, ma'am, kasi
Yes.
mawawala po tayo, no? Sa
So
direksyon.
for the next 3 years, starting 2022 to until 2024, so that is 3 years, 3-story construction of Camp Nakar Station Hospital. Hand in hand, we were able to establish our stakeholder engagement. Marami po kaming stakeholder engagement, the DPWH. Thank you so much to DPWH for the 3-story building amounting to 150 million.
150 million, ha?
Yes. For this year, 50 million ang release, and then we are...
So staggered siya, ma'am, muna.
Yes, multi-year. Okay?
Alright.
And then together with the Director of DOH Region 4A, Dr. Valencia, maraming salamat, sir, kasi talagang tinugunan niya yung needs ng Health Service Center Southern Luzon. So by phase, for instance, first floor, so ipoprovide niya sa amin yung mga equipment para operational na siya for the first floor, second floor, and so forth and so on. And I'd like also to highlight also siguro yung mga best practices namin in terms of resource management. Alam naman natin na maliit ang Health Service Center Southern Luzon.
Yes.
With the meager resources, we are able to effectively and efficiently utilize our resources. In fact, mababa ang aming readiness condition in terms of personnel, but we are able to manage, no? 2-3 mga designation, and ayun, so very happy that we are able to accomplish our mission in the spectrum of military operations during peacetime, conflict, and then wartime. And we are working on the continuum of care. Ang strength namin is more on the prevention, promotion, early detection. Ang curative and rehabilitative, syempre hindi na namin pa pupuntahin ng pasyente sa aspect
Yes,
na
ma'am.
dahil maliit nga yung resources namin. We are more on the prevention, promotion, and early detection. In fact, through our commanding officer, nagkandak kami ng isang study na naman ngayon regarding the health status of SOLCOM personnel and basis for wellness program. Kasi nga gigibain ng aming hospital. So
When will be the time na gigibain talaga siya, ma'am?
anytime.
Malapit na. Anytime talaga.
Ang na lang namin is the...
Nag-evacuate na kami. So kami magiging orphans na. Tapos after the boring test, demolition na. And then groundbreaking. We were so excited about the groundbreaking.
Alright, so malapit na. Abangan ninyo ang kaganapan na meron magkakaroon ng panibagong hospital facility ang inyong AFP Health Service, lalo na dito sa Health Service Southern Luzon.
Tsaka gusto ko rin, Rhey, na
Sige ma'am,
ma-acknowledge-
highlight natin.
Gusto ko rin ma-acknowledge yung individual accomplishments.
Ng mga tao.
Yung
Correct.
kanilang personal scorecard. Kasi if not, they are not able to accomplish yung personal scorecard nila, di ba, sa organizational structure. Maliliit man ang kanilang mga designation. But pag tinotal mo siya to sum it up,
It will be a big impact, ma'am,
Correct.
para sa organization.
so
Diba?
tsaka yung teamwork, kasi malaking bagay yon kung
Ayun.
bakit namin na-accomplish, kung ano man ang...
Nararamdaman ko nga yung teamwork dito eh. Ano lang to, ibig sabihin kasi we just would like to highlight why they achieve a lot of this achievement, kaya nakuha nila yung Best Health Service Center because of the teamwork of this personnel na nandito sa ating Usapang Health Service. 13 minutes to go po to extra, sir. Okay? Sige, alam ko yan. Anyway, thank you, no? Thank you, ma'am, for giving us the opportunity na malaman na ating mga katropang nakikinig sa atin, lalo sa dito sa Usapang Health Service. Moving on tayo, sir, no? Talking to highlight everything, no, dito sa ating Health Service Southern Luzon. Siyempre, knowing about the pandemic, sir, no? The COVID-19 pandemic na meron pa rin na nangyayari dito, considering na we do have booster vaccination program, but still, we need to have the social distancing. Pero tayo ngayon, wala man tayong social distancing, sir. Kasi sabi mo nga, naka-5 booster dose ka na. So this is the important thing behind is that galing po kami nagpa-antigen test. So, kami nung pag-arrive namin dito, nung Friday, no? Bigla kaming pina-antigen. So this is our first time na nagkaroon kami antigen test dito sa area. But anyway, negative naman. So it's a nice ma'am, effort na to have a safety and protocol sa ating mga personal para hindi tayo mahawaan. Sir, talking about yun nga sa COVID-19, nung nagsimula ang COVID-19 pandemic, ano po ba ang naging response ng Health Service Southern Luzon and towards this pandemic, no? At marami po din bang mga pasyenteng naapektuhan, lalo na sa ating mga personal ng Health Service Southern Luzon?
Marami din siya, pero of course, the Health Service Center Southern Luzon will not do it alone. So we need the support of the SOLCOM. They created a committee. No, on the hospital level, we have a COVID coordinator that will get in touch with the updates of IATF, and of course, SOLCOM cannot do it alone. So to collaborate with DOS. So we also are part of Region 4A IAT meetings every now and then, and you know that SOLCOM's the camp is with PNP. So did you know that our triage is being managed by the Health Service Center and with the PNP?
So, ibig sabihin, sir, meron palang police, no? Na Philippine National Police, provincial siya, sir, di ba?
Yes.
Na naka-assign or nandito talaga sa loob ng kampo ng inyong Southern Luzon Command. So it's a collaboration.
So parang ano siya, it's a community approach. No? Everybody should own responsibility in preventing COVID. So yun
Kasi meron din silang medical health service, sir, na naka-attach.
Meron din naka-attach sila. So laging collaboration yun. We cannot do it alone. So therefore, ano talaga yung stakeholder? Doon ang strength namin eh. So we always do stakeholder. Hindi lang kami matalino lang, kami ang health service. No, we educate people so that we would have a zero COVID here.
Ayun. Kagandang pakinggan. Palakpakan naman natin ang Health Service Southern Luzon with their effort, with their collaboration, with their coordination, with their teamwork na sabi nga natin, it doesn't really affect them even though they're having an interagency effort kasi ito, sir, na kinatawag natin. PNP, DPWH, LGU, or other Department of Health na within the Southern Luzon Command. Kasi nga, hindi nila kaya within their level lang muna because talking about COVID-19, ang dami pong pasyente nagkakaroon ng COVID-19. So, siguro sir, an average, ilan po ba so far na nagkaroon tayo ng sa ngayon, wala. Pero
zero.
During that time, marami po ba talagang personal na nahihirapan ba kayo na ma-establish yung mga EQF when you started this COVID-19?
We have EQF naman, so hindi naman siya na full house. Pero pag mga moderate to severe symptoms, we evac to Viluna as per protocol. Okay?
So dito, ina-admit natin because of without symptoms lang, no?
Symptoms or mild symptoms. But when it comes to moderate, we evacuated to Viluna as per protocol because we cannot handle that. The medication, ICU needs. No, so evacuation to Viluna.
Kasi yung EQF, sir, na meron tayo dito sa Southern Luzon Command is also a license to operate, di ba, by the Department of Health. So depending on the level of care, no, kaya mild or no symptoms lang po ang pwedeng ma-accommodate. Kaya baka nagrereklamo yung iba natin, bakit sila inibak ng Viluna or other private hospitals or government hospitals because that is the mandated task given by the Department of Health as well as the AFP Health Service Command through proper echelon of care or leveling.
I have to correct. Wala nagrereklamo because
wala na ba?
Oo, kasi
in case lang, sir, ba, na merong magrereklamo para for the information nila.
Kasi magaling kami mag-explain.
Ayun. So, ibig sabihin, walang nagrereklamo. Maganda ang establishment of rapport together with the Southern Luzon Command personnel. So, at least, they have given the opportunity na maging maganda ang kinalalbasan ng ating mga pasyente dito, sir. Sir, how about dito, sir? Sa mga, ano-anong mga hospitals ang tumutulong sa inyo? Talking about sa dami ng mga cases ng COVID-19, no? Ito ba ay naagapan ka agad during that time?
Naagapan naman. So usually it's Quezon Medical Center. Siya yung government hospital.
Quezon
Medical Center.
Medical Center, sir.
Yeah. We have also stakeholders there, yung provincial director. So sa kanya kami kumuha ng mga rapid antigen test. Ano ba bang kinuha natin? Mga PPEs. So kung hindi ma-provide ni Bilo na may call a friend kami.
Alright.
So hindi kami nababawasan ng kinukulangan ng supply.
Okay. So meaning to say, dito sa Health Service Southern Luzon, pinapalakas yung stakeholder engagement ng ating mga guests this afternoon with the help of our acting chief, at the same time, our CEO Hospital and Dental and Vet. No? So ang ganda ng collaboration. Di ka lang pupunta pa ng iba. Dito lahat meron ng mga resources na pwedeng bibigyan pansin ng ating mga kasundaluhan at mga dependents or other authorized civilians na kailangan care. Sir, talking about sa PNP personnel, having nandito sila sa kampo, no? Would there be a chance na, in case of emergency, pwede bang malapitan ng ating Health Service Southern Luzon or sa ating hospitals na available, pwedeng i-treat or to manage them in such a way na to stabilize their care?
Yes, of course. We also cater to PNP personnel. So we gave them emergency management, treatment, and then we transferred it to their hospital of choice. And since we cannot evacuate them to Viluna, but rest assured, they will be taken care of at the emergency room of Kamlakar Station Hospital.
So, how about sa mga, siyempre, PNP is considered civilian na rin pala sa atin, sir, no, in the organization. So, meaning to say, kaya nga meron tayong, our vision or our mission will be to, siyempre, to have a quality healthcare services para sa ating mga kasundaluhan, sa kanilang mga dependents, And of course, authorized civilians na tinatawag. So, yan yung mga authorized civilian human resource. Siyempre, we need to involve our civilians kasi baka sabihin ng mga civilian human resource dito, hindi natin sila inaalagaan. Lalo na sila po, no, na pwede silang maka-avail ng ating mga treatment or management of care. Sir, talking about the reservists, are they qualified for having, as long as, ano bang kailangan? Yung mga reservists. Siyempre, merong mga ganyan, sir, na pupunta dito, nagkaroon ng problema.
Actually, we have a reservist doctor here that is very active sa health service center, sa Kamtakai Station Hospital. So therefore, we also cater to the service. Since sa health fair, they help us. If we need help for disaster, they responded to our call. So as a matter of gratitude na lang, we also cater to the service.
All right. So for the information din, sir, yung mga reservists, as long as they do have their annual tour of duty, no, yung ADT or sir, no, na dapat meron ng order kasi that is one thing of making sure na lagi silang nandun in case of services, lalo na ngayon sa COVID-19 pandemic or any disasters that may arise, no. Kaya we need them, no, during this time of pandemic. Kaya maraming mga reservists ngayon or mga medical allied na nagkaroon ng call to active duty. So that is one part of our introducing our information about this reservists, no. All right, dadako naman tayo, sir, dito sa ating mga gwapong mga kasama pa rin, no? Headed by Colonel Arcilia, sir, and Lieutenant Guevara. Konti na lang, madam, ha? How about po sa dental dispensary, sir? Ano po ba ang mga capabilities meron tayo at ano yung mga innovations na going stronger to strengthen the dental dispensary habang dumadami na yung mga pasyente natin dito sa Southern Luzon, Command?
Thank you very much, Rhey. Ang Camp Nakar Dental Dispensary ay binubuo ng 3 military dental officer at nag-iisang civilian dentist namin. Pero magkaganon pa man, kahit marami kaming pasyente, nagagampanan namin ang lahat ng pangangailangan ng ating mga katropa dito sa Solcom at kung saan pa mang unit silang gusto nilang magpa-treat dito, pati ang kanilang mga dependents. Available sa atin ang periodontics, sakop nito ang oral prophylaxis, ang restorative dentistry, ang pagpasta.
Papapasta, sir, no? Very common talaga yan sa mga
tapos
sundalo natin.
Nakakapag-provide din tayo ng pustiso.
Alright,
at
so
surgery.
Surgery, pustiso. Kalimutan natin. Maganda ang pagkagawa, sir.
Maganda. Ayan itong model na.
Si Sir Sabala yung model natin yung pagpapagawa ng pustiso. So sa ating mga kasundaluhan, sir, na willing magpapagawa, punta lang or call lang yung hotline nating dental dispensary.
Meron din tayong online consultation kung kayo po ay nangailangan ng atensyong dental. Anytime po ay pwede nyo kaming i-message sa aming Viber at sa aming Facebook page.
Okay lang ba daw, sir? May tanong dito. Ay madaling araw mag-message.
Pwede rin, no? Mababasa namin yung kinaumagahan.
At least we are 24 hours naman ang ating service, sir, di ba? In case there are emergency. May naiiwan namang OD siguro, sir, di ba?
Meron po.
Ayan. So,
kahit po weekend, meron.
Kasi hindi natin alam na may mga emergencies na nangyari, di ba, sir?
Yun nga, ang sakit ng ngipin, walang pinipiling oras.
Walang pinipiling oras. Sir, ano yung mga good innovations na meron tayo ngayon sa dental dispensary?
Ayun nga, maganda. Kasi gawa nitong pandemic, medyo nahirapan tayong ibigay ang full dental attention sa ating mga pasyente. So, sa pamamagitan ng pagsunod sa protocol ng IATF at sa pamamagitan na rin ng mga na-formulate na policy ng AFP Dental Service sa pangunguna ng aming Chief Dental na si Brigadier General
Torres. Si Ma'am.
Naisa katuparan namin ang pagbibigay ng atensyong dental sa nagbigay ang AFP Dental Service ng mga equipment tulad ng air humidifier, purifier, saka HEPA filter. Sa mga gamit na to na i-provide namin ang dental service, pangangailangan ng ating mga pasyente ng konti na lang yung agam-agam na kami ay gawa ng sabi ko
Siyempre, talking about COVID-19, sir, no, ang hirap pag binubunutan mo yung pasyente, siyempre open yung bunganga, yung hininga, di kayo yung maapektuhan. Kaya napaka-importante yung mga humidifier, yung mga equipment na kailangan sana po maintindihan po ng ating mga viewers, lalo sa mga tropa, mga dependents, na ginagawa lang din po ng part ng ating mga dental dispensary, lalo na si Sir Arcilia, sa pangunguna ni Sir Arcilia sa dental dispensary, yung mga serbisyong dapat din, safety first yung kailangan, di ba, sir?
Oo. At hindi mangyayaring lahat ng yun kung wala kaming suporta, siyempre, ng Health Service Center.
Ayun, palakpakan
Southern
na naman
Luzon.
natin sa Southern Luzon.
At very timely, wala ni minsan na pagkakataon na hindi sila sumuporta, mapa-resources,
Yes,
at
sir.
lalo na yung mga PPE natin. At yung Health Service Command, may nabibigay
May mga
sila sa
binibigay,
atin,
sir, ng
no?
mga equipments.
Na kahit na hindi mo hingin, ay pagka biglang dumadating na lang. Kukunin ko pagkakataon ito, magpasalamat sa ating commander na si Brigadier General Cardinosa sa patuloy na pagsuporta sa aming lahat dito.
Alright, so congratulations sa ating dental dispensary. At least nagagawa nyo pa rin yung tungkulin ni sir despite this COVID-19 pandemic.
Yun na nga.
Sir, dako naman tayo dito sa ating bet. Parang excited na talaga siya. Kanina pa siya eh. Sabi niya, ano ba ito sasabihin ni sir? No? Talking about veterinary dispensary naman po, ano-anong mga capabilities meron na pwede nating pagserbisyuhan ating mga katropang nakikinig, lalo na sa Southern Luzon Command personnel?
Currently, ang Camp Nacar Veterinary Dispensary is categorized as a non-surgical veterinary treatment facility. With that, yung animal healthcare service namin is very limited lang sa outpatient services, sa disease prevention, like vaccination and deworming, and mga preventive medicines. And since wala rin kaming mga MWD, we focus mainly on the veterinary.
Yun yung mga military working dogs,
dogs.
no, na tinatawag,
Yes,
no, yung MW, kasi baka hindi nila alam yung ano yung MWD, Moral and Welfare Development. So yan, no, wala tayong mga K9 units dito sa aming area, no, but anyway, because
wala nga kaming ganong capability, we focus mainly on the veterinary preventive medicine activities such as environmental sanitation inspection, food sanitary inspection, water analysis like water potability testing, and misting operations for dengue control.
Alright, so meaning to say, marami pa rin ginagawa ang inyong veterinary services. No? It's not just about the services that we render, talking about the pets, yung mga aso, pusa man dito, but talking about the COVID-19 pandemic, malaking instrumento ang inyong veterinary service having their role, their primary role also, no, to have mga misting operations, no, sa all areas ng Southern Luzon Command.
Together with the camp commander, in
Camp
collaboration
commander.
with them,
Ayun.
the veterinary dispensary together with them spearheaded the COVID-19 disinfection, lalo na sa mga offices
opisina
na nagkaroon ng positive.
Alright, so thank you for that. Lalo na sa mga food services natin,
Yes,
mga
sir.
pagkain, no?
Correct.
You are trying to correct kung ano mga dapat to have a good safety din na mga, siyempre magkaroon tayo ng food poisoning. Papunta yan sa kay sir ngayon, ubos na yung mga resources ng CEO Hospital ngayon. Pero alam ko naman, mayaman to si sir, may-ari ng Coca-Cola product, may-ari ng Heart Center. So, kompleto na. Anyway, nagbibiro lang kami dito. Anyway, these are very important services na malaman natin sa veterinary service, talking about the COVID-19 pandemic, hindi lang po para sa aso, para sa pusa, but also, in general, marami pong services na pwede nilang kayang gawin.
Yes, sir.
Alright. Ano po ba ang mga kinikater natin, lalo na sa mga outpatient? Kinikater po ba natin yung mga, like sa PNP, sa other areas like civilians? Pwede po bang magpa-check yung mga aso nila kung sakaling?
Yes, sir.
there
They're
will be-
very welcome na magpa-check
Ayun.
sa amin. Lalong-lalo na yung mga military personnel, authorized dependent. and-
Mga chihuahua, mga pitbull, wag lang yung aso sir, yung tao. Diba, sir? So definitely napaka-importante, no. We could also cater, no, kasi nga we do have what we call, kami nga nag-medical mission tayo, ma'am, di ba? Talking about stakeholder engagement, napaka-importante ba? No need any amount of money to give our services because
Correct.
we are in the military. We are there to serve our people. We are there securing the land. No? Yan yung army pala yun. The sovereignty of the state and its people, but on the side of the APL Service Command, we are there to give our medical and full services that we are committed, of course, to help and save lives for our people. All right? Okay ba? Okay, last part na po tayo, ma'am, kasi alam ko wala ng oras, no? Ma'am, ano po yung pwede nating maibigay sa ating mga katropang nakikinig at nakikibalita sa ating ngayong umaga? Any message, ma'am, to promote your Health Service Southern Luzon. Huwag na silang mag-atubiling pumunta at siyempre bisitahin yung CEO ng hospital, ng dental at ng vet upang sa ganun mabigyan sila ng serbisyo at kasi tingin nila baka siyempre napaka-importante yan at the negative effect na kulang ang services na ating may render. Ano po yung pwede nating may payo?
Yes, inaanyayahan namin kayong lahat na pumasyal sa Health Service Center Southern Luzon, sa hospital, sa dental, and sa vet for their services. And rest assured that the center will continue to be a dependable and reliable arm of Southern Luzon Command in providing medical, dental, and veterinary services, not only to our soldiers for a fit-to-serve SOLCOM personnel, but to their dependents and authorized civilians. So thank you so much to our stakeholders, internal and external. Thank you so much to the Commander, Southern Luzon Command, Lieutenant General Bacaro, sir, and to the Commander of AFP Health Service Command, Brigadier General Cardinosa. Sir, continue providing support to our center, sir, para sa bayan ang malusog na pangangatawan ng kasundaluhan natin, sir, dependents and authorized civilian. Yes, sir. Yan ang magpapa-continue ng pagbabago sa kaunlad ng ating bansa, sir.
So thank you, ma'am. Thank you, sir, for giving us this opportunity na makasama kayo. This is a 1-year opportunity lang. Minsan lang tayo nagkakaroon ng ganito, but at least the teamwork that we saw this Usapang Health Service dito sa Health Service Southern Luzon, it's a great opportunity to give information dissemination campaign and all the services that they could render and give to you, lalo sa ating mga katropang taga Southern Luzon Command. Binabati rin natin yung mga watching live here sa ating Facebook page. Edward Enak, Sofia Penson, Arlene Singkay Magusara, good afternoon po sir, Katropang Rhey, at sa lahat ng guests, sa lahat ng viewers, God bless and stay safe. Sa lahat po sa inyo, no? Kasi alam ko naman wala ng oras. By the way, next week, no, dito sa ating Usapang Health Service will be live, no? This coming next week, Monday, no, sa Health Service Central, yon sa Cebu City, sa Visayas Command naman po tayo, dadako. So anyway, thank you for giving us this opportunity again once, ma'am, no? Sa ating mga katropa dito sa Southern Luzon Command, sa pangunguna ni Lieutenant General Bacaro, Philippine Army, and to our Commander, Health Service Command, General Cardinosa. Thank you, sir, for the support. We are still making our AP Health Service Command aiming high for our vision that we could be a world-class healthcare services provider by 2028. Maraming salamat. Good afternoon. God bless and mabuhay tayong lahat.
Mula noon hanggang ngayon, ang iyong AFP Health Service Command patuloy ang pag-aalaga, pagbabalita ng mga serbisyong pangkalusugan para sa mga kasundaluhan at sibilyan.
Ito ang iyong Usapang Health Service dito lang sa DWDD AFP Radio. Iba tayo!
Kayo ay nakatutok sa DWDD AFP Radio. Kami po ay kasapi ng KBP, Kapisanan ng mga Broadcaster ng Pilipinas.